Hello, my name is Dr. Dewan S. Raja. Today I will discuss about Lambert-Eaton myasthenic syndrome. Lambert-Eaton myasthenic syndrome is a neuromuscular transmission disorder caused by antibodies directed against presynaptic voltage-gated PQ calcium channels. This is a neuromuscular disease. This is a paraneoplastic disease. It is also a type of autoimmune disease. It is often associated with small cell lung cancer, over 50% of cases. So, in that sense, it is a paraneoplastic disease. A paraneoplastic disorder, antibodies against the tumor antigen cross-react with voltage-gated calcium channel in the presynaptic membrane, impairing the release of acetylcholine in the synaptic cleft. Synaptic cleft is a space between the presynaptic part of the synapse and the postsynaptic part. In between them, we have the synaptic cleft. It may be associated with other autoimmune diseases, so not necessarily always there is cancer associated with Lambert-Eaton syndrome. It may be associated with vitiligo. There is some problem with pigmentation of the skin. Pernicious anemia. There is associated with antibody against the intrinsic factor in the stomach, and there will be deficiency of vitamin B12 or thyroid disorder like that of hypothyroidism. About 5% patients are in pediatric age group without an associated cancer. And sometimes on rare occasion, we don't know the exact cause of Lambert-Eaton syndrome. Lambert-Eaton syndrome is a rare disease. In the United States, the prevalence is around 400. Here, the clinical feature: weakness of the proximal muscles of the limb, specifically the lower limb muscles. Upper limb muscle, proximal part may also be affected eventually. There will be fatigue, weakness of the entire body system. Muscle strength improves with use. In contrast to myasthenia gravis, in myasthenia gravis, we have more use of muscle, more fatigue, more weakness. But here in Lambert-Eaton syndrome, muscle strength improves with use. Repetitive stimulation builds up sufficient intracellular calcium and helps in acetylcholine release from the presynaptic membrane to the synaptic cleft, eventually to the postsynaptic membrane. Extraocular muscle and bulbar muscle. Bulbar muscles are the muscle innervated by the cranial nerve, which are coming from the medulla oblongata. The 7 to 12 cranial nerve supplies the muscle of the head and neck. Those muscles plus the extraocular muscles. These muscles are spared in case of Lambert-Eaton syndrome. They may be involved in the late stages, but early stages, these muscles, the extraocular muscles and the bulbar muscles, are spared. Autonomic dysfunction like dry mouth, constipation, and erectile dysfunction or impotence may also occur. So, how can you diagnose Lambert-Eaton myasthenic syndrome? Diagnosis by electromyography, nerve stimulation test. Okay, nerve stimulation increases the muscle strength. We must check the PQ calcium channel antibody titer. Chest radiograph and CT scan is very important to find out any type of lung cancer. Okay. Treatment of the underlying cancer like small cell lung cancer, it should be debulked and its treatment should be started. Plasmapheresis, we can remove the antibody from the plasma, will give back the fresh plasma without antibody. Immunosuppressive drug like prednisolone, azathioprine, that is helpful. Guanidine 3,4-D-aminopyridine, that this drug will help in acetylcholine release. This is popular in Europe. And the last one is the drug approved for children in Lambert-Eaton myasthenic syndrome, that is the G, that is emifempridine. This is the only one FDA drug for the children with Lambert-Eaton myasthenia syndrome. So now we may differentiate between the myasthenia gravis and Lambert-Eaton myasthenia syndrome. Myasthenia gravis may be associated with hyperplasia of the thymus or maybe tumor of the thymus gland, thymoma. Here, Lambert-Eaton myasthenia syndrome is associated with that of small cell lung cancer. Okay. And also repetitive use will increase the strength of the muscle, but in case of myasthenia gravis, repetitive use will cause weakness of the muscle, to increase the weakness of the muscle. Extraocular muscle is mostly affected in case of myasthenia gravis. Extraocular muscle, bulbar muscles are rarely affected in Lambert-Eaton myasthenic syndrome. Okay, so acetylcholinesterase is the drug of choice for myasthenia gravis. That does not work good in Lambert-Eaton syndrome. For Lambert-Eaton syndrome, we'll manage in this way by plasmapheresis, immunosuppressive drug, or like diaminopyridine, maybe G for children. Okay, so these are the differences between the Lambert-Eaton syndrome and myasthenia gravis. Myasthenia gravis more or less benign in comparison to Lambert-Eaton syndrome. Lambert-Eaton syndrome is associated with small cell lung cancer over 50% cases, so prognosis is very poor in Lambert-Eaton syndrome. Myasthenia gravis prognosis is comparatively better than that of Lambert-Eaton syndrome. Okay, and that's all about the Lambert-Eaton myasthenia syndrome. If you have any question, please feel free to ask me. Please share the information with your friends and please support me. Please subscribe my channel and have a nice day. Bye now.